As we move down the face, we get to the mid-face and the neck. Here, again, we have ptosis of the mid-face fat, or the malar fat pad, which accentuates the nasolabial fold. The labiomandibular groove and the neck are affected by the platysma muscle, the mid-face fat, and fat and skin of the neck. The way to address these is with a rhytidectomy or facelift procedure, which is essentially a face and a neck lift procedure. Through the 1960s and even the 1970s, this was primarily a skin-only procedure. But as I've told you, it's not just the skin that's affected with age, and these underlying structures are affected as well, so they need to be addressed. And this was recognized in the 70s and 80s. During that time, the skin and the SMAS facelift was developed, and this repositioned some of those deep structures. In the 1990s, the deep plane facelift was developed, which is the technique of choice today. With this technique, those structures are repositioned even more effectively. What is the SMAS? The SMAS is the superficial musculoaponeurotic system. It can be thought of as a fascial layer that envelopes facial muscles and helps resuspend facial structures. This can be used to resuspend deep soft tissues of the face by repositioning of the SMAS. The deep plane facelift involves elevation of not only the skin, but these deep structures by elevating this SMAS layer. This SMAS can be elevated anteriorly to the point that the muscles of the face are visualized. It's important to note that the facial nerve runs underneath these muscles and is protected during this surgery. The incisions used are those of typical facelift. They extend into the hairline, behind the tragus of the ear, behind the posterior portion of the ear, and back into the neck. And postoperatively, the patients can expect sutures such as these. Issues addressed in facelift include neck skin laxity and banding, jowling of the neck and the midface, nasolabial folds, midface ptosis or drooping. Issues not addressed are skin pigment abnormalities, fine wrinkles, and of course the eyebrows and the eyelids, which were addressed with those procedures I mentioned earlier. Here's some results. Here's a patient who was interested in having a more youthful appearance. She was concerned about nasolabial folds, jowling along the neck. And postoperatively, these areas were improved greatly. This is shown even more on a lateral view, where preauricular skin redundancy, lack of a strong jawline, and a weak chin were addressed with a facelift and actually a chin implant, which I'll be describing a little bit later.